Patients entering an in vitro fertilization cycle face a grueling reality. They commit to tens of thousands of dollars in medical bills, inject heavy doses of synthetic hormones, and endure immense emotional stress. Yet, despite deploying some of the most advanced medical technology available, standalone IVF often encounters a strict biological bottleneck. The procedure yields a surprisingly low clinical pregnancy rate, usually hovering right around 26%. This bottleneck is especially harsh for patients labeled as low responders. These are women whose bodies, despite heavy hormone stimulation, produce very few mature follicles or suffer through repeated failed implantations. Western reproductive technology excels at forcing a biological action, extracting an egg and fertilizing it. But when it comes to optimizing the body's baseline receptivity to actually carry that embryo, the process struggles, leaving many patients exhausted and burned out. To solve this problem with receptivity, fertility clinics have started integrating modern reproductive technology with a 4,000-year-old medical practice, acupuncture. This chart visualizes the findings from a landmark clinical study in Germany. When researchers added just 1 day of acupuncture to the standard IVF cycle, administered right before and after embryo transfer, the pregnancy rate jumped from 26.3% in the control group to 42.5%. Looking at the cover of Dr. Li Fang Liang's clinical manual, you can see how far those numbers can climb. Her clinical experience shows that a comprehensive, multi-month acupuncture protocol can push IVF success rates to between 40 and 60%. These increases are not a placebo effect. They reflect measurable changes in the patient's internal biology that improve the mathematical odds of creating life. The integration of these two medical disciplines relies on a specific division of labor. Western medicine provides the seed by cultivating the embryo. Eastern medicine prepares the soil by optimizing the ovaries and the uterus. Human eggs and sperm do not mature overnight. The biological timeline for maturation takes roughly 70 to 90 days. During this 90-day window, precise needle placements stimulate the nervous system, increasing blood circulation directly into the pelvic cavity. This localized flow actively lowers follicle-stimulating hormone, indicating improving ovarian function. Over 3 months, patients often double their follicle count, and the uterine lining expands its thickness, creating a receptive bed for the embryo. Alongside these internal changes, the 90-day prep protocol heavily mitigates the harsh side effects of synthetic fertility drugs, sparing the patient from severe physical exhaustion before the procedure even begins. By the time the patient arrives for their IVF cycle, the internal environment has been entirely redesigned. The reproductive system has shifted from a hostile, stressed state into a hospitable one. Transfer day carries specific physiological dangers. High patient anxiety, combined with the lingering effects of IVF medications, frequently causes the uterus to spasm. A contracting uterus can actively expel a newly transferred embryo. To prevent this, practitioners carefully needle targeted locations on the ear. Needling these specific points sends a signal directly through the autonomic nervous system that overrides the body's stress response. This neurological shift triggers an immediate mechanical effect. The cervix slightly dilates, giving the physician a clear, unobstructed path for a safer and far less traumatic transfer. A secondary effect follows almost immediately: deep, involuntary relaxation of the uterine muscles. The contractions stop, allowing the embryo the physical stillness it needs to safely implant into the uterine wall. Even after a successful transfer, the risk of miscarriage remains daunting. For women undergoing IVF around age 40, that risk hovers near 50%. Ongoing acupuncture support during the delicate first trimester manages hormone levels and regulates the immune system, ensuring the body does not mount a defense response to reject the implanted embryo. On transfer day and through the critical weeks that follow, acupuncture acts as a biological anchor. It physically holds the pregnancy in place, exactly when the body's natural anxiety threatens to disrupt it. We can see these mechanics play out clearly in clinical case studies. One specific patient entered treatment after suffering severe pelvic infections, completely blocked fallopian tubes, and multiple failed IVF cycles. After integrating Chinese medicine into her IVF cycle to address her internal environment, her body responded by producing 35 follicles, leading directly to the birth of healthy twins. Standalone IVF reaches limits because it treats fertility purely as a mechanical challenge of extraction and implantation, isolating the reproductive organs from the rest of the body. Acupuncture offers an ecological solution by treating the body as a whole, acknowledging that reproductive success relies on a synchronized internal system. By integrating ancient practice with modern fertility technology, clinicians can move beyond the limits of standalone procedures and provide the biological foundation needed for new life.